Michelle and I, Dr. Michelle, and I have been through it all. She's kind of famous in our world of pregnancy, OB, fertility, but we have been through it all. I mean, I will say, like, I don't know of any closer relationship with a doctor that I've ever had in my entire life. I always think I'm dying.
That is true.
That is true.
Let's actually take it to expecting mothers. If you are having a C-section and you think you're going to labor, what would your number one tip be?
Number one tip, do not eat or drink anything until you talk to your doctor.
Interesting.
I had one of my best friends, Dr. Baker. I'm going to out her on this show.
Dr. Susan Baker. She's in Beverly Hills on Bedford. She is phenomenal.
She called me and said, I think I'm in labor, scheduled for a C-section. I was like, okay, well, you got to go to the hospital. Let's check you out. And she said, okay, I got to finish up here. And I said, don't eat or drink anything. And she goes, Michelle, I just had a ham sandwich. So number one tip is we need your stomach empty. And people think when they go into labor that they should eat something and drink something. And then we delay everything. So that's the first tip. Second tip is call your doctor.
Call your doctor.
You know what the best thing about you is, and I will say this about any doctor, she is my friend outside of this podcast, outside of Cedars-Sinai, outside of her office in Beverly Hills. We are actually really good friends. But while I am her patient, she is my doctor first and my friend second. And I would love for you to expand on that just a little bit. We've had a few friends of ours get really close to their doctors, and sometimes the friend comes out before the doctor comes out.
I think that's true, and I think it takes time to realize when you're the physician that you need to, when it's time, put your doctor hat on. And it doesn't matter what someone's asking of you, and it doesn't matter what someone wants if there's an emergency. So I love my patients. I want to be on the same page as them the whole time, but I always say, if the shit hits the fan, like, this is what you need to do. And I am able to, I guess, get that across to you.
You are. And I also think, like, sometimes we have this idyllic thing in our mind about our birth plan. And when, I didn't know that I was going to have a C-section on my first baby, I had what's called developmental cord insertion. And she's going to really tell you exactly what that means. But around 12 or 13 weeks, I ended up doing, what was the old test we did before the maternity 21 test?
The first trimester screening test.
Yeah. And so basically they found that something was weird. And then at 20 something weeks, they were like, you're never going to have this baby naturally. And it was like a little bit of I was sad. It's what I said kind of in the beginning. Like, I wanted to be you. I wanted to have three. You had your first one naturally, right?
No, I had all three C-sections.
C-sections? I didn't want to be you then. I
wanted to be me.
I wanted to be you.
Yeah.
You had Ava and Layla, who are awesome girls. I wanted to have that experience. And I think we get very tied to what we have in our mind. And I think sometimes that just doesn't happen. And she was very careful about saying, things change.
Yeah.
We might have a birth plan now, but we might not.
I've actually renamed it. So it's a birth request now, right? And to your point, you can want whatever you want, and I want you to. It's your day, and I had my day the way I wanted with my two kids, and I want people to imagine how they would imagine having their baby, but with the caveat that I don't know what's going to happen, you don't know what's going to happen in labor. There needs to be flexibility, and sometimes we're going to change things.
And all you want is a healthy baby.
All you want is a healthy baby.
Because I was almost 2 weeks overdue with my first. I was 12 days overdue.
Right.
And they put me on everything. Pitocin. I had the Foley, which is basically the water balloon that they do. I mean, it was, I had an epidural just for that. And she didn't want to come.
But I think at the end of the day, like, when your kid's 12, you don't remember that you had an intrauterine pressure catheter or that you got 10 units of Pitocin instead of 5. It's, you have your baby who's now your kid.
Yeah.
Right?
And who's safe.
Exactly.
Because some people, why do they wait so long? Why do the doctors wait so long to have this natural water, whatever kind of holistic, when you're like, we got to get this baby out? Why is that?
I think part of it is what we already talked about, that some doctors are swayed by their patients and what their patients want more than what they know is medically right. And you have to be able to draw that line. And that's why I think which we'll probably talk about later, but the doctor-patient fit is so important. You have to choose someone that you not only have researched and you know has good credentials, but that you feel comfortable with, because then you're going to trust them.
What should someone, you're not in LA, you're not in like, you're not here with you, and you can get you as your doctor. What advice would you give women when they're looking for their OB or any doctor?
So I always tell people when they call me and say, Dr. Hakakha, I'm moving to Wichita, like, what, do you know anyone there? And I'm like, no, but you can call the best hospital, call labor and delivery, ask to talk to the charge nurse, and ask them for recommendations.
Oh, that's a great idea.
Because we work with all the nurses. They know who's good. They know who's not great. You can have someone who has amazing bedside manner who's terrible in the operating room, or you can have someone who on paper went to Harvard, sorry, Sanchez, and all these other places, but their bedside manner is terrible.
Yeah.
So I think if you ask either the charge nurse, or if you have friends in the area or family members, you're most likely going to get along with your friend's doctor and who they've researched.